Thank you, Madam Mayor, Commissioners. I am Rob Lord. I'm the president of Cleveland Clinic Martin Health. I oversee the 3 hospitals in the Treasure Coast, Martin North, Martin South, and Tradition Medical Center. For a COVID update, we're setting new records every day. The number of COVID patients admitted to our hospitals. As of today, at North Hospital here in Stewart, we have 91 COVID patients in the hospital as inpatients. Overall, we have 155 COVID patients in our 3 hospitals. That is by far the highest number we've had in this surge. Compared to prior surges, the previous high was on January 25th of this year. It was 111. So we've gone from 111 to 155 here. Less than a month ago, that number was consistently below 20. We were running for a period of about 5-6 weeks in the teens, combined in all of our facilities. The average length of a patient's inpatient stay is 9.5 days. A lot of those patients are discharged within a couple of days. They come in, we get them turned around that way, and we can get them home. But we also have a lot of patients that have been in our hospital for 30 days. Once they get so ill that they require a ventilator, the prognosis for that patient is not as good as it was before that. During the surge, about 90% of the patients in the hospital have been unvaccinated. The vaccinated patients who are ending up in the hospital generally have an underlying condition that caused their immune system to be suppressed. And likely as a result of that, when they received the vaccination, they did not get the full protection of that, because the way the vaccination works is your body uses that vaccine to develop antibodies, and in some of those cases perhaps they were not. But I think what is incredibly important for me to point out is that even for those patients, they are not winding up in the ICU, and they are not winding up on ventilators. We're getting those vaccinated but immunosuppressed patients out of the hospital. And just yesterday, our organization lost a patient that was in his 20s and was healthy as he could be, from what I understand. This new variant is a different animal. We have lost too many unvaccinated patients. Over the last 10 days, by my count, we've lost 17 patients. We do have more ICU patients than ever before. That's 11 at North and 25 overall. We have more ventilated patients than ever before, 8 at North, 17 overall. My last understanding is, again, that all of those patients currently in the ICU and ventilated patients are unvaccinated. As for hospital operations, I need to say this, and many of these people live in your community. I have never been more proud to work with a remarkable group of caregivers whose professionalism and skills and commitment, not only saving lives every day, but it's just incredibly inspiring. The phrase frustrated is inadequate to express what I see in my organization. It is in my experience, a special brand of frustration. The combined mental and physical exhaustion. I wish I could capture that level of frustration, and I would ask that you please forgive our clinicians if they ever express any frustration to you, but here's the way I see their plight. Imagine if you'd fought a battle for 18 months, and you were holding your own, but you weren't making a lot of progress because you didn't have any weapons at your disposal. And then someone handed you a weapon that said, "We can resolve this battle." That was a vaccine. We had the solution in our hands. And yet, so many of us have chosen not to take advantage of it. I think quite often relying on misinformation. It's hard to not be a little bit irritated at someone who puts you in that position, if that's your job. And those are the people that are coming to the hospital. But the people that get into healthcare didn't get into healthcare to be angry at their patients or frustrated with their patients. They're caring, compassionate people who want to take care of people. And what I've seen in the frustration is when they feel those feelings, they have these horrible pangs of guilt. And they try to fight that off, and it's taking a toll. It is a remarkably frustrating job right now, and that just needs to be said. Under the circumstances, they're also watching these young, otherwise healthy people suffer needlessly, and in some cases die needlessly, and that's not what we do. Those people, they look at those patients, and those patients should not die. So it's a unique, deep brand of exhaustion and frustration that our caregivers are experiencing. I would ask that those of you that are praying people, keep them in your thoughts and prayers. I know I do. But I'm worried about the mental health of our caregivers, and I think we should all be. If you know one, express your appreciation for them. We're getting by as a hospital, but we have our limits. Every hospital has its limits. We are challenged with staffing. There are simply not nurses available. We are bringing in just under 50 traveling nurses to augment our nursing staff. They will arrive over the next week to 10 days. And that is at tremendous expense. It is an incredibly competitive market these days. What nurses are able to get as travelers is unprecedented right now. But that's something that we normally did only in the season. Under the most severe of circumstances, we would go hire travelers in January, February, March if we had to. This is our slowest month of the year normally. And right now our hospitals are full. Our bed space is limited. The long lengths of stay that I mentioned before are really important in that, because when a patient walks through the door, most of the time, if we can look at a patient and say this patient has pneumonia or this patient needs a knee replacement, give me a procedure and I can tell you more or less how long that patient will be in the hospital. It may vary by a day or two, but here it can vary by 30 days. And so managing beds is a huge challenge. So as a result of that, we've converted many of our floors in the North Hospital to dedicated COVID units. We've stopped doing elective cases that require lengthy stays. Trying to do all of the same day surgeries, a few overnight stays if possible, but for the most part, elective surgeries are not available in this community right now. And so we've canceled those surgeries. We are doing emergent and urgent surgeries, and I want to note that for our community members. And we try to liberally construe that. If I've been diagnosed with a condition that may be cancer and there's a diagnostic surgery that needs to be done to do a biopsy or something along those lines, to me that's urgent. And all those patients, we're trying to make sure we get them in. But it's going through a process that we'd prefer not to go through. We have contingency plans to house more patients than our facilities are designed to hold. That's obviously less than ideal, and our ability to staff those beds is questionable. My message to our entire community, and I just need to get this out there to everybody that we can, this is not an inexhaustible resource. I have conversations with people around town that feel like, well, worst case scenario, I'll come to the hospital and you'll take care of me, and the answer is that's not a guarantee. We cannot guarantee that. There is a point at which it's true in every hospital in America, you can overwhelm it. We have strictly limited visitation, again, because of the higher infection rate in the community. COVID patients are not allowed visitors. We do have mechanisms in place for that they can visit with loved ones with using iPads and that sort of thing. And other patients that are hospitalized, unrelated to COVID, are allowed one visitor during their stay. Finally, I'd just like to talk for a minute about the Delta variant. It's not the same illness we were combating last year. Medical evidence is becoming overwhelming that one cannot rely on natural immunities acquired from having had a prior variant of COVID to protect you from the Delta variant. We're seeing a lot of patients in our hospital that thought they were immune from having previously had the illness. Children are getting sick. It was not the case in the past, and they are transmitting it. In general, hospitalized patients are younger. and much healthier than they were early in this pandemic. Pregnant women are more at risk. I believe we have 2 pregnant women in our system right now under our care for COVID. The variant seems to be smarter. What I've been told by the clinicians, by the epidemiologists, is that it gets into our systems and it's able to hide from our immune triggers so that it can replicate before the immune system recognizes it. So if you're vaccinated, you can contract the illness and pass it on. You may never have symptoms, but you may be a carrier of that. There are a few breakthrough infections, but what we're concerned about is there may be many more of us that are walking around with it, giving it to others, not having any effect ourselves. And that's something, I think that had a lot to do, there's a study that came out, the CDC's reaction to it was the mask guidance for vaccinated people. I think as much as anything, the concern there, this is speculative on my part, but I think their concern was as much as anything else that vaccinated people could be spreading this as well. It is many times more contagious than what we dealt with previously, and it causes greater injuries and death. And in closing, I would just give you my thoughts on this. Everything suggests to me that this pandemic is unlikely to end anytime soon. I doubt that this is the last surge, and I doubt that this is the last variant. There's nothing I'm aware of that would justify me saying something to the contrary. Given the reluctance of so many to get vaccinated, this looks more and more to me like it will become a way of life for the indefinite future until something changes dramatically in our society. And if I were in your position, the decisions I would make would be with that assumption in mind. And I will be pleased to answer any questions. And again, I thank you for the opportunity to come and speak.
Thank you very much. You had important, valuable information, and I appreciate your honesty. We do have a question from Commissioner Fender.
Well, Mr. Lord, thanks for coming and addressing us and bringing current and timely information on the current surge and what's going on in our hospitals. I appreciate that. A couple of questions. First, I was going to ask about the percentage of breakthroughs because I share your frustration and the content I see on social media about people who just haven't quite accepted that this is a concern for both vaccinated and unvaccinated people. And so I want to reiterate what I think I heard you say, and you can correct me, is that there is a small percentage of breakthrough infections for people who are vaccinated, but having that vaccination seems to protect them. And you were saying that getting that vaccination keeps them out of the ICU, even when they get that infection, correct?
Yes, sir. What we have seen, again, the vast majority of breakthrough infections, they're not that many. It's 1 in 100 sort of a number. I have a son-in-law who works in a local restaurant, was vaccinated, but he tested positive. He went home and he isolated himself, but he never had any symptoms. Never had any. That's pretty common for your healthier population. When you get to some of the people, the only significant breakthrough infections, not the only ones, I think the vast majority of those that wind up having to come visit a healthcare provider are older and or have, almost always have a pre-existing medical condition of some kind that is tied to this. If it's not immunosuppressed, it's they have significant allergies or they have other conditions that we know will exacerbate any sort of respiratory condition. That's what this is. I mean, SARS is severe acute respiratory syndrome. That's the acronym, and that's what this is.
May I continue? Okay. Yeah. So I was also intrigued by your statistic that showed that at our peak in January we had 111 patients, and today we have 155. So it seems like the peak now is much worse than the situation was back then. But I feel like, from your words, that these are largely unvaccinated patients. Some not, but mostly by the vast majority, especially those in ICU. So this feels like a high risk for that portion of our population that has not yet been vaccinated.
Yes, sir. It has essentially become a pandemic of the unvaccinated.
Yeah, frightening. Okay, well, like I said, I share your frustration on social media every day of people who continue to want to convey the misinformation that this isn't a significant health risk for not only themselves, but those around them. So and we've lost members of our community in Sills Point, as you're aware. And also, like you said, we have great caregivers here as well, which we thank for their hard work. Some of the information going around, and I'll share this as well, and you can address it, is that the percentage of unvaccinated members of our healthcare community is alarmingly low from the inaccurate information I might have.
It's alarmingly high.
Yeah.
I would say that we have far more caregivers than I would like. Now, when we give those statistics, we don't break it down by doctors, nurses, other members of our staff. When we talk about a caregiver in the Cleveland Clinic, that's everybody who has a badge. The vaccination rates among doctors and nurses is higher.
Okay.
But some of the same misinformation and I don't mean, it is not my intention at all to get political. I am apolitical on these issues. This virus is indiscriminate. It does not care about your beliefs
Absolutely.
or your politics or anything else. It is just a relentless opponent. But I've got friends that view this as a question of their personal freedom, and somehow it's become an important cause for them, and I try to talk them out of that. There are others I've talked to on religious grounds, but again, I'm a man of faith, and I find that reliance misplaced in my opinion, and I'll try and have that conversation. By the way, I'm open to have a conversation with anybody about this.
Awesome.
I'm not shy, and my skin is thick. But as you go down the list, it's so many different things that motivates people. It's people that believe there's a microchip in the thing, and they can track us. I mean, there's lots of stuff out there, and it seems to be at this point almost impossible.
There's not, right?
Pardon me?
There's not.
No, I don't know anybody that believes that that's possible in the scientific community.
Good to hear. All right. Hey, thanks for your comments, and I really appreciate you helping us convey positive, proper information to the community, because it's definitely needed right now. Thanks for all you're doing and your team
My
as well.
pleasure. It's an honor to be here.
All right. I see no other questions or comments, but yes, I want to say thank you again. A very reliable, trusted source of good information. Thank you.
Thank you very much. Have a great day.